All right, I'm going to be covering mini labs number 7 and 8. So I'm going to wash my hands. Good morning. My name is Ginger. I'm going to be your nurse today. Can you please tell me your name and date of birth?
Sure. Lauren Everly, 11/23, 1981.
Okay. Close this curtain for privacy. So I'm here to do an assessment of your peripheral vascular system and your abdominal system. Do you have any questions for me?
No.
Is that okay?
Sure.
All right. I have my equipment. Can you please put this gown on?
Sure.
So my first question is just overall, do you have any pain that you're feeling?
No.
Okay. Do you have any pain in your calves when you're walking?
No.
Do you have any swelling in your legs, arms, anything like that? And have you noticed any skin changes?
No.
Okay, great. So first going to start with your upper half. And looking at your arms, they are symmetrical. There doesn't seem to be any type of discrepancy in size. Your color is uniform, no hyperpigmentation that I'm noticing. As I continue to look, I don't see any lesions, I don't see any ulcers, and I also don't notice any edema on your upper arms as I do the inspection. So the next thing I'd like you to do is to take your fingers and put them up like this. And looking for that diamond, and there's no signs of clubbing. So if you could also put your fingers out like this. And then I'm going to test for capillary refill. And you have a nice brisk response, so it's less than 2 seconds. So that all looks wonderful. So moving on to palpation, the first thing I'm going to do is just to palpate your arms and test for temperature, and your temperature is equal bilaterally. Now to palpate your pulses. So I'm going to do your radial, which is 2+ regular, and then your brachial is also 2+ regular. I'm going to as well stand on this side. So doing your epitrochlear nodes, and I do not feel them. There's no enlargement that's noted. And then do it also on this side. And then noted on that side. Right. All right, so moving on to your lower extremities. So once again, I'm going to go ahead. Is it all right if I put this up now? That way you don't have to pull your legs. As I'm assessing your initial assessment, they are symmetrical in size. Skin color is uniform throughout. I don't notice any lesions or ulcers. There would be a gown present, so that's why I'd be able to see all of that. And I don't notice any edema as I look down your legs. So that looks all right. Now that this is up, can you go ahead and lie back? All right. So the first thing I'm going to do is I'm going to palpate your inguinal nodes. So right along the groin line, I'm going to do your vertical and your horizontals. And just to palpate, I do not notice any enlargement or any nodules under my fingers. The next would be to auscultate and palpate your femoral pulse. Is that okay? All right. So if I palpate your your femoral pulse, it should be a 2+ and regular. And now I'm going to air listen with the bell side over both femoral arteries. There's no bruits that are present. And then moving on down your legs, go down to your posterior tibialis. So I'm feeling on the back side. They're about a 2+ and regular, and then your dorsalis pedis, which is right on top. That also is a 2+ and regular. Both of them are 2+ and regular. So now if I could have you, I'm going to check you for vascularities, but I think what I'm going to have you do, I'll have you stand up in just a second. So I don't notice any in this position of supine that there's any phlebitis or any kind of vasculitis or varicosities. Go ahead and sit up. I'm going to have you stand up for a second, and then I'm going to have you get back on the table. So standing in this position, allowing at least 2 minutes time, and then if you could pull your pant legs up so they would be pulled up as best you can. to pull them up. And again, looking for any kind of pooling for varicosities or any phlebitis that was noticed, which I do not notice. Thank you very much, Miss Lauren. And then back on the table. So now we're going to move on to the abdominal system, if that's all right. I'll wash my hands since I touched your plate. So have you noticed any changes in your appetite? Have you had any abdominal pain? Have you had any diarrhea, constipation, nausea, or vomiting?
No.
Okay. And when was your last bowel movement?
Yesterday.
Okay, great. So I'm going to have you lie down again. Thank you for being so amenable. And could you please take your knees and just slightly bend them? Excellent. So inspecting your abdomen, you are symmetrical. I don't notice any masses or nodules when you are lying there, and your umbilicus is where? Perfect. So it is midline, and if I was able to visualize it, I would notice that it is uniform in color and that it is concave. I can tell that, but there's no drainage coming from your umbilicus or any concerns. Any pulsations, I see respiratory breathing, but I don't see any abdominal pulsations that would be of concern. And then skin color also is uniform, and the contour of your abdomen is flat. So those are the things that I would be assessing. So we're going to start with auscultation. Using the diaphragm. Can you press your belly button again? Thank you. All right, you have normal active bowel sounds in all 4 quadrants. Okay, and now we're going to listen to vascular sounds. So I'm going to switch to the bell of my stethoscope. Point to your belly button, please. Great. So I'm going to go up. And that's aortic. I don't hear any bruits. So now I'm going to go to renal right, renal left. I have iliac right, iliac left. And I've already assessed her femorals, but if I hadn't, I would continue down to do a femoral. This is femoral left and femoral right. And I don't hear any bruits throughout. Now I'm going to percuss. So you can feel me tap on your belly, all right? So you have tympany with a little hypertympany, little gas bubble that we may have all heard. But we love you. We love you.
Watch out.
So now we're going to do some light palpation. Okay, so look at me. Just tell me if there's any pain or tenderness when I do this. So.
No.
Okay.
Stop trying to work it out.
All right. Deep palpation, I am going to just verbalize. I'm going to use both my hands. That's my personal preference. I'm going to do 5 to 8 centimeters deep, and then I'm going to be feeling for any enlargement of your organs or any masses that I can feel, and I do not feel any. So that is wonderful. Mm-hmm. Okay. So from that, we're going to go ahead and have you sit up, and it's CDA, so you need to be on this side. That's okay. So I'm just going to place my hand on your back, and you're going to feel some thudding. So just let me know if this causes any pain.
Nope.
Great. You'd have no signs of pyelonephritis or any kind of pain in your back. So that is great. I did not find any abnormalities throughout these 2 assessments. Do you have any questions for me?
No.
Okay. Nothing to report to the provider, but I am going to go ahead and document my findings.
Okay.
Okay. Wash my hands.
Thank you.
Thank you.